Hello, and welcome everyone to a talk to Tony Wilson. Today we will discover what happens when COVID-19 visits our home. My guest today is Melvin Jefferson. He's a resident of Gaston County in North Carolina. Thank you, Melvin, for taking time to share your experience with COVID-19. How are you doing today?
I'm doing well, thank you.
Great, great. Glad to hear that. Well, let me just start by just asking this question. Um, What made you decide to go be tested for COVID-19? Had you been having symptoms, or did you feel like you were exposed to someone that was positive? What made you actually go be tested for COVID-19?
I was in counter of being exposed within my work. Um, I didn't feel any symptoms. I just felt as though, just as far as me coming in contact with someone that was positive, that I suggest myself that I should become in counter as far as being tested as well.
Okay, great, great. Now, there's other family members in the household. Is that correct?
Yes, ma'am.
How did they react when you told them that you needed to go be tested for COVID-19? What did they say?
They were very shocked, did
Mm-hmm.
not believe me. I told them that I was in the mix of being exposed to someone that
Mm-hmm.
was positive with COVID-19. Um, so I felt as though that they were just out of the loop, didn't know what was going on, very shocked.
Mm-hmm. Wow. Okay. Well, had anyone in the household been sick, had any symptoms of COVID-19 that you're aware of? I know there's lots of symptoms, but as far as you know, had anybody had any symptoms of COVID-19?
As far as I was concerned, no one was showing any symptoms or showed any signs as far as COVID-19 symptoms. So I would say no.
Okay. All right, that's fair enough. Um, so some people are quarantining outside of their home, like maybe in campers or detached garages or other buildings on their property. Now, when you did your quarantining, where did you do your quarantining?
I did my quarantine in my bedroom. I just pretty much just stayed locked in and away from my family.
Okay. Okay. At what point did you start your quarantine? Did you start it like when you were told that you may have possibly been exposed, or after you got your test results? When did you start your quarantine?
So I started my quarantine as soon as I knew that I was exposed to COVID-19.
Okay. Okay. And where how was your quarantine? What did you do while you was in quarantine? Or how did you feel just being in the house,
Um,
in the bedroom, by yourself?
as far as how I felt, I just felt that I was isolated as far as I couldn't talk to anyone outside of being interacted with them in person. It just felt very unusual to how I'm usually able to interact with people on a daily basis. So it was very hard for me to process that, especially within
Mhm.
how things are within my family.
Okay. Very close family.
Yes, ma'am.
Yeah. Okay. So your test came back positive. Were others in the household, were they tested as well?
So others in my household were tested, but all their tests came back negative.
They're all negative. Okay. So did y'all have to go back, or especially did you have to go back and be retested, or what was suggested to you at the time just to make sure that you were clear of COVID-19?
Um, Based on my symptoms, as far as me showing asymptomatic symptoms,
Mm-hmm.
far as being tested again, it was a suggestion on me, not as far as anyone else. I felt as though that I was told that after 14 days, I could just resume um, social activity within others. Just be cautious of how I interact with them, as far as wearing my face mask and 6 feet social distancing. So I felt as though that I was able to myself get tested again.
Okay. 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 Well, that's good. And I guess your second test that you had come back negative.
Yes, ma'am.
Okay. So did your family members go back and retest, or Were they okay with the first testing that showed up negative?
They were okay with this first test that
Okay.
showed up negative.
Okay. And then there was nobody that was symptomatic afterwards?
No, ma'am.
Okay, that's great. It's fantastic. Okay, how are you feeling now? We hear that there's a lot of people that's having residual health concerns after they test positive and then they'll go back and test negative for COVID-19. They're still having some breathing issues, some aches and pains. How are you feeling now since you've gone through that spell of COVID-19?
As far as I'm feeling now, not necessarily as tired as I am when I was exposed with COVID.
Mm-hmm.
As far as my test coming back negative, it just feels though that certain things are still in the mix of symptoms, as far as a little bit of scratchy throat, as far as trouble breathing a little bit more,
Mm-hmm.
and also with a little bit of sneezing and coughing and runny nose.
Okay. Did before COVID-19, did you have any respiratory issues or issues with your lungs, anything like that?
I did not, ma'am. No,
Did
ma'am.
not. Okay. 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 So from my understanding for what you're saying, no one in the household tested positive after you were positive. That is just remarkable. Can you share with us what you and your family um, did to help prevent spreading the coronavirus in the household? 'Cause that is just remarkable.
Yes, ma'am, it very much is. And the things that we did, far as whenever I was quarantining for myself,
Mhm.
as we would play a part in this for the mix of us, had no clue what to do.
Mhm.
Far as the things that we were doing, far as utensils, we would uh, purchase paper plates, paper cups, and paper utensils just to help prevent the spread of the virus throughout the kitchen accessories that we use together. And far as things that we do now, we're definitely wiping down counters, wiping down doorknobs, anything that you can use as far as cleaning supplies. We're definitely using that at least twice to three times a day to be able to spread the virus still as we mobilize ourselves and interact with each other.
Okay. Now I've heard some families say they use separate bathrooms. Was that true for your household?
No, ma'am.
Okay.
Pretty much just after what we do is after we use each other's bathrooms, we just pretty much just wipe down everything.
Okay. Well, look, y'all, there we have it. We did the social distancing. We did some cleaning of household products, used some paper products, paper utensils, just staying clean in the household as well. Is there anything else that you would like to share with us to help keep us safe in our homes if COVID-19 comes to visit?
Yes, ma'am. I would like to share if you all have any symptoms or feeling any certain type of way, as far as the COVID-19, as far as it's not clicking in your brain correctly on what to do
Mhm.
or how to do it, just please, please reach out to anyone that you know that has been exposed or is been in reach or has any knowledge on this COVID-19, because it's very serious out here. Anyone can get it at any age. So I do advise just stay cautious of what you're doing in your household and just be more knowledge as far as washing your hands, who you're being around, who you're sharing things with, because it's very serious and it's getting to the point where we just need to be very alert.
Thank you, Melvin. You have given us hope and proof that the distancing and the cleaning and probably the face covering when you're out in the public is what we need to do. Your family has been an example, a great example of what we all need to do if COVID-19 visits our home.
Yes, ma'am.
This concludes our talk to Tony Wilson. I just want to thank you, Melvin, again for sharing your experience. And at this time, I will say thanks, everyone, and have a fantastic day.